the show, Brian.
Thanks for having me. I'm happy to be here.
Can you please share how Hope and Help provides primary care and support to adult transgender clients in various stages of transitioning?
Absolutely. So we're fortunate enough that we have a full-time physician on staff. So that's allowed us to comply with recent changes in the state legislation and be able to continue to offer that care to clients in the greater Orlando metropolitan area. So we've started to welcome probably 5 times the amount of new clients into our clinic over the past couple months. So we've been happy to be able to do that. So having a physician on staff who can prescribe gender affirming care and cross-sex hormone therapy has been key to that program.
What inspired you to focus your career on transgender healthcare and rights?
That started during my doctoral research at UCF. So I'm a recent graduate last year. UCF Knight, go Knights.
Congratulations.
But when I was looking for my topic and jumping into the research about what's out there, what needs to be improved, who needs help, I was drawn to marginalized populations. And being a member of the LGBTQ community and having trans friends myself, I had seen those experiences firsthand, and being an emergency nurse by background, I've helped care for individuals like that. And so it was something that really spoke to me, and I knew that there was a need for that training and that education. And so that's what drove me to study that during my doctoral research there, and then gave me the opportunity to bring that knowledge and expertise to the Hope and Help family to help guide that program as well.
How do you ensure that Hope and Help's healthcare services are inclusive and tailored to the unique needs of the transgender community?
Constant research and knowledge. So we have a great group of providers on staff who are always hungry to learn more. But that's really the hallmark of a good clinician, right? Is always looking at what is the current evidence support and what are the current practice standards. And so that's what we use to drive our program there. So Jenna Wimmer, who is one of our APRNs on staff, is truly an expert in gender affirming care. She has helped develop the protocols in the program and really made herself an expert and helped guide new practitioners as they've come on and helped bring our own physician up to speed in best practices in gender affirming care. And so that's really how we do that, is always going back to the literature and leveraging your content experts too, because care is always changing, especially in a field like gender affirming care. We're always learning new things and discovering new therapies. So it's really important to stay abreast of that information.
What are some common challenges transgender individuals face in accessing proper medical care, and how does your organization address them?
So probably the biggest challenge has been the changes that have occurred as a result of SB 254. So prior to that legislation, a lot of individuals access gender affirming care through a nurse practitioner. The vast majority of prescriptions for HRT were issued by nurse practitioners, not just in the state of Florida, but pretty much across the United States. And that legislation has changed that now that has to be done by a physician, so either an MD or a DO. So that's created a challenge in access to care. We're fortunate enough that we have a full-time physician on staff, so we've been able to continue access to our program. We have had to change how we handle that, obviously, because the physician has to be the primary prescriber, but that has allowed us to continue to offer that resource to the community. Initially, when we started the program, it was small. We'd have 3 or 5 new clients a month. Now we're seeing upwards of 60 to 70 new clients a month. So the demand is there. But that's probably the biggest issue that's impacting this community is access, because there was already a physician shortage before this change happened. And so it's now put more pressure and made a significant challenge in individuals being able to get to a physician in a timely manner to access that care. So we're super thrilled to be able to continue to offer that to the community.
Can you give us an overview of the current legal protections for transgender individuals in Orange County?
Yes, so probably the one that's most talked about is SB 254, and so that centered around access to gender-affirming care and specifically hormone replacement therapy. So it is different for individuals under the age of 18 and individuals over the age of 18. So our program focuses on individuals over the age of 18. That was our standard before SB 254 was enacted, and that was really just from a comfort level of our providers. But it does require that they have to see an MD or a DO in order to gain access to gender-affirming care and HRT prescriptions. And so that is not necessarily a legal protection. It's more of a legal restriction for individuals to get to care. But that's probably the biggest impactor, that and the informed consent process that recently changed. So it requires individuals to get informed consent from a physician in person. That again, it's not really a protection; it's a restriction. What I would love to see is changes to that legislation to make that less restrictive, to let individuals be able to see nurse practitioners like they had before, and to utilize telehealth services to get access to gender affirming care, because that would greatly improve their access.
So, are there any protections that are available?
Oof,
Because those were our limitations. Definitely.
yeah. Honestly, there's nothing.
Well, that's sad.
It honestly, that's why it's disheartening. So that's another reason why I focus my research on gender affirming care. There's not a standard of education for every provider out there. It's just now being incorporated into curriculums. There's also not a lot of legal protections that exist for those individuals seeking gender affirming care, and so that really is kind of the sad truth that exists. Right now, we're trying to break down barriers and restrictions before we can approach protections.
Yeah.
Because it still varies even across the United States. Something as simple as protection in employment and housing is not consistent across the U.S. and in Florida. So that's the sad answer, is there's not a whole lot of legal protections for access to gender affirming care right now.
How can local government and organizations support the transgender community in areas such as legal documentation and gender marker changes?
Be a voice for the community. Definitely listen to what their needs are, because they're going to tell you. But helping advocate for a response that's based in science and fact, because what we know is the literature and research tells us that this is safe and effective care for individuals, and we don't want to restrict that access. So it's advocating for removing the barriers to care is really how public officials can assist us. So advocating for removal of a lot of the restrictions that we saw from SB 254, allowing nurse practitioners to provision care again, allowing individuals to access gender affirming care via telehealth methods. Those are the big things that would really help this community, is to help them break down those barriers to make access to care easier. Because access to care was a challenge before. So adding these additional restrictions have made it just vastly more challenging for this community.
How could viewers become more involved in supporting transgender rights and healthcare in Orange County, either through volunteering or other means?
One great resource that's out there is Equality Florida. They have a great website of keeping people abreast of changes and opportunities to be present and speak. Just recently, I had the opportunity to attend the Board of Medicine hearing on the informed consent process. And that could have used a lot of community voices. So turning up in spaces like that to support individuals that are transgender or gender nonconforming, and helping them and raise their voice up so that they can be heard is really the key. It's also important for people to vote. Let your voice be heard, so that we support legislators and representatives for the state of Florida that are going to support access to gender affirming care and help us remove those restrictions and barriers.
Are there any upcoming events or initiatives that Hope and Help is having that the public can get involved with?
Absolutely. So we do our annual AIDS Walk. That's probably the biggest event that we'd love public participation in. So it's an opportunity not only to support Hope and Help, but to drive awareness around the care and the services we provide, and to help remove that stigma around individuals living with HIV and AIDS. And so that's an annual event that we hold every year. We would love to see more people participate, whether you want to come out as a participant at the 5K, or if you want to be a vendor that helps support the program and just be a partner. We'd love to see you.
What are some personal experiences or stories from your work that illustrate the importance of the services provided by Hope and Help?
So I'll touch on two. So when you think about the core mission of Hope and Help, which is ending the HIV and STI epidemic, we have had the opportunity to have individuals come in and give testimonials to our agency about how the care they've received has changed their lives. And probably the most notable was a heterosexual couple that came to us last month. And so this was an individual who was newly diagnosed with HIV, completely out of care, very unwell, and they were having housing insecurity, food insecurity, and so brought them in. They were able to get connected through our patient assistance program to get care within our medical clinic, to get access to life-saving medications and antiretroviral therapy. And then through the work of our incredible case management team, they were able to get them into stable housing. And now that individual's viral load is undetectable, so he is healthy and thriving, and they got to share that story with us. And so I thought that was incredibly impactful for someone who's health was very precarious and they didn't know where to turn, that Hope and Help was kind of a one-stop shop for solution there. And when you talk about gender affirming care, I had the dubious pleasure of covering as one of our front desk coordinators the other week, which is dangerous when you put me at the desk. But I took a phone call, and it was an individual calling about her follow-up appointment, but her husband was also in care for us for gender affirming care prior to SB 254 starting. And she wanted to know if we were going to be able to continue care. And I assured her on the phone, yes, we have a plan in place. We have a physician on staff. And she literally broke down into tears, sobbing on the other end of the phone, telling me how grateful she was and how impactful it was for her and her family to not have to worry about getting that care for her husband. And so that really moved me. And it was an unexpected and pleasant surprise, because you do the work every day, but you don't always understand the impact.
What advice do you have for individuals who may be beginning their transition journey and seeking support in Orange County?
Take advantage of the resources that are out there. So at Hope and Help, for example, in addition to the care in the clinic, we've now started a transgender and gender nonconforming non-binary support group called Beyond Binary. That will be on a monthly basis, just like all of our other support groups. But there are a plethora of other support groups out there. The center also has a transgender peer support network. And so it's just know that you're not alone. And there are resources out there to connect individuals, because I think social support is probably the most important piece for an individual's transition, so that they know that there's someone to talk to and someone to help guide them through that.
And how can people learn more and keep in contact with the organization?
So we're on the web, hopeandhelp.org. Our website's up to date, but you can also keep up with us on social media. We're on Instagram, Facebook, LinkedIn, you name it. But we are also out and about in the community, so always be on the lookout for our postings on social media, because we do a lot of mobile outreach through our prevention team. So you can catch us not only at our main location, but also at several locations throughout the community here in Central Florida.
Well, thank you. And we do have an activity just to test my knowledge.
Uh-oh.
Is right. My staff have put these together, so I do not know the answers. There's no opportunity for me to cheat here, unfortunately. I'm going to give you the cards.
Okay.
So you're going to be the quiz master, and you're going to read the questions out to me, and let's see if I know the answer. Oh, gosh.
All right. No pressure. Question number 1. What does HRT stand for? Oh, you get multiple choice help here. Okay. A, high risk treatment. B, hormone replacement therapy. Or C, hormone regulation technique.
The second one.
Correct. It's hormone replacement therapy. Good job.
And I'm going to say thank you to myself and make it multiple choice.
What documents can we provide letters for to assist with gender marker changes? A, social media profiles. B, driver's licenses, birth certificates, and passports. Or C, grocery store loyalty cards.
B.
That was a giveaway. Okay.
Thank you, stop again.
All right. Which gender affirming hormone is commonly used in feminizing HRT? A, testosterone. B, estrogen. Or C, progesterone.
I feel like this is going to be a trick question, but I'm going to go with B.
It's B. It could be turned
okay.
into a trick question, but we'll go with B. That is the mainstay. So good job. All right. 3 for 3. Number 4. How can support groups contribute to gender affirming care? A, by offering a safe space for sharing experiences and support. B, by giving legal advice. Or C, by hosting makeover sessions.
I like the idea of C, but we'll go with A.
So I think they were going with A, but we have in the past, and we will include in the future, just so you know, A, B, and C could be part of that support group. Number 5. What is one potential benefit of HRT for some individuals? A, height reduction. B, improved body odor. Or C, alleviation of gender dysphoria.
This one I'm unsure of.
So the correct answer is C. So gender dysphoria is a primary diagnosis that you see from the American Psychological Association. It's actually undergone several revisions. It's kind of an outdated term, but it's still utilized a lot in healthcare documentation. We prefer terms like gender incongruence, meaning because gender identity and sex assigned at birth are 2 separate things. All right, number 6. Who is recommended to provide a letter of support before starting HRT? A, a family member. B, a therapist experienced in transgender care. Or C, a primary care physician.
C, a primary care physician.
This was a trick question.
Oh.
So this was for a letter of support. So the answer is actually B. So it used to be a requirement. Now it's a recommendation that either a licensed psychologist, psychiatrist or licensed mental health therapist to provide a letter of support for transgender care. Number 7, what's an important consideration when self-administering HRT injections? A, sharing needles with a friend. B, using any available needle size. Or C, following sterile injection practices.
I'm going to go with C. The first two sounds dangerous.
Absolutely.
And the second one sounds painful. Yay!
You weren't competing against anybody, though. So.
Well, thank you so much for being here. And I definitely learned a lot, as you can see. I really appreciate all the work that you do.
No, thank you so much. It's an absolute pleasure and a passion. So.
If you're enjoying this show, please subscribe to our channel and follow our Instagram, Facebook, and Twitter accounts.